should be relevant to everybody. So what is this webinar? All I'm going to go through is 3 different tools today that you'll be able to use for free online in whatever way you want to use them. There's a login to a couple of them, but largely they're just completely free and available to everybody, and they cover the whole country. They have a lot of different functionality, all of them, and they're aimed at different audiences. But there's so much that's relevant to population health management within them. So that's why we put them together and are talking about them in this webinar today. So all I'm going to do is go through the 3 tools one at a time. And then when I get to the end of the explanation of each individual tool, I'll stop and we'll go through any questions. So please do feel free to put questions in the chat box, but I can't see them on my screen. So we'll just catch up with them at the end. Okay, so the first one I'm going to talk to you about is the Hospital Catchment Populations tool. This is a relatively new tool that was created by my colleagues in the east of England in the middle of last year, so it's relatively new and up to date. I'm going to try and do live demos of all of these tools, but we may have to stop that depending on how well the connection is and how it goes, but I'm hoping for live demos rather than screenshots, because I think it's a little bit more, you can see what I'm clicking on and what's happening. So this first tool, unfortunately the link is horrible, so when we send it out in emails we tend to just hyperlink it and say click here, but this is what it actually looks like. So you'll get these slides and you'll be able to click on this link, because you won't find it through Google unfortunately, or anything like that probably, but once you click on that link it takes you through to this, which is a Power BI dashboard. So you'll see that this was created here in July 2019, first published. It has been slightly edited since then as well based on feedback, but this is the original publication date. And the team who created it were Elkis East at phe.gov.uk. I'm from Elkis West Midlands, the Local Knowledge Intelligence Service West Midlands. So if you've got any questions, either feel free to send them through to us or send them on to the East of England colleagues. I don't think it really matters. Either way, you should be able to find somebody who can answer your question. So this dashboard has 15 pages on Power BI. So you just work through the pages one at a time. And it also has an index at the front. This is page 1. When you first click onto it, it tells you just a little bit about the tools and how they derived the hospital catchment populations and the calculations and the models that were involved in it, and also what it can be used for. So there's a little bit here about how it'd be useful for service planning and to show the potential population who may access the services, and thereby gives the provider a useful gauge of, for example, how many staff are required and other capacities. So that's the sort of thing this tool is aimed at trying to answer, but hopefully you'll see from the information there's a lot of different questions that it could potentially be used to look at. So we'll just go through and have a look at some of those. If you want some more information, you can also look at these K-Hub websites. So K-Hub has a lot of more background information, and so you can click on any of these to find out about the populations and again how they're calculated. So you'll see here we've got some drop-up menus which allow you to navigate to the area of the country that you're interested in. So I'm going to click on the West Midlands. And then when I click on the West Midlands, it will give me a list of trusts. Again, they're all in the country. So I'll just choose the first one that I see for the West Midlands. So I'm going to choose Birmingham Women's, but we can change that as we go through. So I'll click on the arrow to go through to the next page. So this is the contents page, and it shows you all the different pages that we have available on the tool. If you want to, you can click on any of them and it will take you straight through, so you don't have to go through all 15 pages, but I'm just going to work through them in order. So I'm going to carry on using these buttons at the bottom. Okay, And so you've got 3 pages of contents, and then this one here is the first page of actual information and data. So this shows a patient flow from lower tier authority to hospital trust. So at the moment, because I selected the West Midlands on the first page and it's come through to up here, I've got all of my lower tier local authorities on this side, and I've got the majority of my hospital trusts on this side, and I've also got a little other here. So if I cut this down to, say, Sandwell, just at random, I've now just got Sandwell on the left-hand side, and you can see now the flow across to various hospital trusts, and the width of the bar tells you the proportion of patients that are going to each of those hospital trusts. So how do I calculate that? So I've got 2 different sorts of admissions. The first is all admissions, elective and emergency. So these are admissions to hospital from Sandwell. I can also go back historically to see how things have changed, and you can see that in Sandwell they have. So we went from having over half going to Sandwell and West Birmingham, with a few going to the Dudley Group and then other. And now you can see that that's changed to Sandwell, West Birmingham, Dudley, University Hospitals Birmingham, Walsall and Birmingham Women's. The other is anywhere that's got less than 5% of patients going to it, and it groups them all together. So you can see that flow really nicely, and you can also change very easily to different local authorities. It groups them by upper tier local authority, just because you get probably 2 small kind of it's likely there wouldn't be much variation at lower tier local authority level. So somewhere where, like Staffordshire, you're going to have all of your local authorities on the left, all of your lower tier local authorities on the left, and then all of your trusts on the right. So that's the first page, and I'll go to Shropshire before we move on. Okay. Oh, and if you hover over the bar, it will tell you how many patients that is per year. So that is 92,000 patients admitted for both elective and emergency from Shropshire to Shrewsbury and Telford NHS Hospital Trust in 2017. Okay, so I can also go the other way. So I can look at Birmingham Women's, which I chose on the first page. Where do patients come from? So rather than looking at a local authority and seeing where do patients go to, I can just do it the other way around. Again, I've got my little drop-down menu. So if I want to look at somewhere else, I can do that really easily. It doesn't have to be within the West Midlands. So here's the Countess of Chester. I should imagine most people come from Cheshire, West and Chester. So you can see very quickly how easy it is to change around and look at different hospitals and different trusts and different local authorities. So very quick and easy to flip and ask different questions. And again, the historical information's there too. Some places you'll see a lot of variation, some places not much at all. Okay, so we now have the Trust Catchment Map, which is a really interesting way of looking at this information in a slightly more granular way. So again, you just choose the foundation trust that you're interested in. It remembers that the last thing I selected on the previous page was Heart of England. So what I'm going to do is I'm going to zoom down to where it suggests I zoom down to, which you can see by the green. And this is now providing me admission by MSOA. So rather than a whole local authority, I can start to look at a much smaller geography. So MSOAs are, you're talking about sort of hundreds of households rather than a whole local authority. So we're getting a lot more granular information. So you can see on this side, this is a list of all the MSOAs where we have patients admitted to the Heart of England NHS Foundation Trust in 2017. Again, I'm on all admissions, but I can select elective or emergency. It tells me how many patients were admitted to Heart of England, how many patients were admitted to any trust in total, because obviously not everybody who lives in an MSOA will be admitted to a hospital at any one point in time. And it also tells me what that proportion is. So you can see that that varies from being in the high 80s for this area of Solihull, which is there. So if I want to see where it is, because these aren't very intuitive names, I can just click on it, all the way down to a very small number. So we've got these kind of 1s, 2s, 3s and 4s down the bottom in places like Dudley and Wolverhampton. And again, it will just zoom in. Sorry, I've got a slight cold, so you'll hear my voice will start to go slightly as I carry on talking. The other thing I could do is first past the post. So first past the post is really interesting in that it will show me so everywhere within an area, every MSOA where, there we go, use first past the post to see MSOAs where the majority of patients go to the selected trust. So it will take away anywhere where only small numbers of patients go to that trust. So that's a really useful way to cut it down. Going on to the next page. So now we start to get some of our age and sex information, which is really useful for kind of that proper public health questions around demographics and who's likely to be admitted, how do they vary from people who aren't admitted, and what are our patient demographics likely to be like in the future. So the first one, we have the trust catchment population. So the trust catchment is everybody who's in that area around the hospital and where people are going to that hospital and have been shown to go to that hospital over time. So it tells you who lives there. So you can see whether, say you're in a rural area with lots of elderly people, you'd see that your population pyramid opened up towards the top. If you've got lots of young children and young families, you'll see this kind of bump here. But for this Heart of England Foundation Trust catchment, you've got more people in this kind of sort of 20s through to 50s middling kind of age group. If I go somewhere else, so I'll try and find somewhere more rural. So let's go to George Eliot. You'll see that that will probably change. Yep, so you can see how it changes quite considerably. So we've got this young children and young families kind of look to it with not many students. And then let's go somewhere even more kind of, yes, let's try Shrewsbury. Yep, so you can see how it varies and how it tells you the sort of people who you may be drawing in and what impact that's going to have on your admissions. You can then see your annual age and sex breakdown for the patients admitted. You'll see that there's always going to be a lot of very young children because that's just how things work. But it gets more interesting as you sort of go up the age band. So you can see these are women in pregnancy, almost certainly. And you can also see that the older women population up here is reflected there as well. So women sort of don't have the same big peak that you see for men in this 65 to 75 age group. So really interesting differences, and this does vary quite considerably depending on which trust you look at. The other thing that's really useful is the proportion of the catchment who are admitted. So you can see that when we're in this kind of 40 to 44 age group, only 10% of females and 7.5% of males get admitted to hospital in any 1 year. But when you get up to 90 plus, this is going up to 34% and 41%. So the ask on the hospitals is much greater. We know that's from what you would just imagine to be true, but it's interesting to see how it plays out and where it really does start to increase dramatically. And you can use that to really think about what that's going to mean for your area. We also have this historical information here, so you can see how things have changed over time, and also proportion of admissions per type by type for selected year. So it just tells you how many of your admissions were elective and how many were emergency for any given trust. Moving on to the next page, we also like to, in public health, we do a lot around demographics, I'm sure you know. So we've included everything that we have access to in terms of deprivation and also ethnicity. So you'll see that you've got your ethnicity breakdowns here. Again, this can be really useful for if you're doing service planning. So say if you've got a large Asian population, you may need to think more about services around diabetes, for instance, in the broadest sense. So there's all sorts of things that you can use this information for. And you've also got information around your deprivation. So we use the index of multiple deprivation quintiles. So 1 is in the most deprived and 5 is in the least deprived. We're in Shrewsbury and Telford, so we're going to have a fairly less deprived population. If I go into somewhere else, let's look at Studley. If I can find it. Maybe I can't. Let's try Burton. Burton is Staffordshire. So you can see how it varies as we go through. So there's going to be very different outcomes for very different rates of deprivation and ethnicity and all of those different demographics. If you look at the different trusts, and depending on what question you're trying to answer, will vary on how useful this information is to you. Again, we can go back in time. And again, we can put on the first past the post. So we're only looking at areas where the majority of people who are going to that trust who are admitted. So you can see how that changes dramatically. So within where it's true, this is the much closer area around the hospital. So lots of places in this kind of East Staffordshire area. If we go false, it moves out to this kind of Derby area and a bit further into Staffordshire. Okay, so we've now got the Trust Index of Multiple Deprivation rank, which is where we've tried to rank the level of deprivation in the catchments of every hospital trust. So this can be really helpful, just giving you a way to really benchmark the trust that you're interested in against the others. So is it one of these much more deprived hospital trust populations? So you can see that Sandwell and West Birmingham is second most deprived in the country according to the scale that we're using. And if I go down to the bottom, it's places like Royal Surrey and Buckingham and Buckinghamshire and Hampshire have got the least deprived catchments. Again, this is all information that we're trying to put together to have available for you to answer the questions. It probably won't change that much on this measure, whether you're looking at elective or emergency, but again, you can do that if you want to. Okay, so this one is giving us a crude hospitalisation rate by MSOA. So MSOA being the small area geographies that I mentioned earlier. So this here is Shropshire. So you can see that because the population of Shropshire is quite small and it's quite a small number of people spread out over a large area, your MSOAs are very large because they're based on the population size rather than geography size. But you can see just how much it varies across just Shropshire. So it gives us a much better idea than an overall value would do. So I'm just hovering over it. It gives me the crude hospitalisation rate per 1,000 population, and then it gives me a number as well. So you can see the numbers are very small, but the crude rates tend to be around sort of 75 to 95. I've got this information over here in a table, so if I want to, I can look at it in tabular format as well, though I find it quite difficult with the MSOA codes because you don't really know where those actually are unless you know your MSOA codes a lot better than I do. So this page, you'll see that a lot of the pages in this tool are labelled experimental. That's because this is the first time the tool's been created. So please do provide feedback on it because they will use that to make this better as time goes on, and I know that they are thinking of doing future versions, so your feedback would absolutely be valued. There's email addresses at the front and back of the tool, so please do get in touch with them. So this is basically telling us the beds per 10,000 people within that catchment area, the beds per 10,000 admissions, and then the bed occupancy. So it tells you, you'll see that you've got the dates under here. So this is quarterly data. So it just tells you how this has varied as time has gone on. And again, it's really easy to look at a different trust. So I should just click to Barking, just to go out of the West Midlands. And it will just vary and it will change very quickly. It's quite a reactive tool. You can also look at it on the map as well. So you can look at any trust and see how it varies. So just move around like that. Okay, so this is our tree map. So this is where we have information on STP catchments rather than our previous trust catchments. So if I just select one of our STPs, I'll go Birmingham because it's near the top. So this tells us our STP catchments here is over 1.5 million. And this shows you the spread, the MSOAs, where patients attend a trust within the STP. And that's by MSOA level as well. So I can see just how far it's spread. And interestingly, you've got one person down here in Oxford came up. So you do see these little individual people as well. And then it tells us, if we look at the map, it tells us the trusts that we have and their individual catchments. So that's University Hospital Birmingham NHS Foundation Trust. This one's the Heart of England. And so what we have here is this tree map, and it just shows you exactly how many people go to the individual trusts sort of in just this tree map format. So if people are off, if there's anything off the end of the map, so the Royal Orthopaedic Hospital, for example, you can make sure that you've got them all there as well. And you also see the relative size of the individual ones as well. So it's quite useful for those sorts of comparisons. And again, you can go back historical. And I'll change it to elective. And you'll see that the orthopaedic disappears because we're looking now at emergency, and it's not an emergency hospital. This is now our national catchment map. So if you see at the bottom, the colour fill in the map represents the acute trust who is the dominant provider within each MSOA. So it just gives you a really nice overview of who the dominant provider is and how far their catchment area spreads. So if you just want to see this information very simply on one map, if I hover over an area, it tells me, so I know that that sort of salmon pink is Burton Hospital's NHS Foundation Trust. I know that this dark blue is Worcestershire. And this one that's just off the end is Gloucestershire. So you've got people coming up from Gloucester, even though they technically live in the bottom end of Worcestershire. So that information is just there, and I think that's quite a nice visual representation of who our main trusts are and how broadly their catchment areas are spread. So I'm still back on 2011, so 2017 will change things ever so slightly. Do remember to check all of your settings as you go through, because it does remember throughout the tool, even though the settings may not be what you want to look at for each individual page. So make sure you always recheck them and set them as you go through. When you get to the end of the tool, you get this further information page. You also get some notes about data suppression. So data has been suppressed to remove any trust where the number of patients admitted to a trust is less than 7 and replaced with a 0. So there's just a couple of caveats that you want to be aware of. There's also a link to allow you to download the underlying data files. And it tells you what we can supply. So we can supply tables in this visual as CSV files on request. And there's also a feedback form, and I know they're really, really keen to get that feedback. So please do get in touch with them if you've got any feedback or further questions, because I'm sure they'd be really happy to hear from you.